we have to emphasize on is that perimenopause is a state when there is high FSH compared to LH, and this is the stage at what time the lady can have ovulation because of the high FSH level and the super sensitivity of the follicles to that high FSH. So, these people can ovulate accidentally, and because of that there are high accidental pregnancy chances in the perimenopausal woman. This thing always should be kept in mind. So, whenever you are dealing with any perimenopausal woman for HRT, you have to first make sure whether the patient is sexually active or not, and today's world you find them sexually active. So, if they are sexually active, you have to first find out what sort of contraception they are going to use when they are sexually active. If the partner is not very comfortable using the barrier method, which actually they are not, because again you are talking about the partner also of the age group of 54-55, then considering that point, the mainstay of therapy in the perimenopausal age group, the HRT, remains the oral contraceptive pill. Got it? जितनी भी स्लाइड है उसका क्रक्स ये है. So, in a perimenopausal woman, forget the symptoms and all, the mainstay of the therapy in the initial phases will be the cyclic OC pill containing both estrogen and progesterone. It can be any low dose estrogen OC pill like Crescenta LS, Yasmin, whatever is there in the market. Now, what this OC pill will do? OC pill will provide the HRT, but along with that OC pill will also help in the contraception. Third thing is OC pill will help in the controlling that erratic release of the hormones in the body, which is causing huge problem. Please understand, perimenopause is nothing but it is you can say expanded PMS. A lady who is getting a PMS is 3 days agony before the menstruation, but perimenopause is like 2 years agony or 1 year agony or maybe more than that, because there is erratic hormonal release and also there is the sensitivity of the brain towards the very low or very high doses of estrogen and progesterone, mainly the progesterone. So, also the OC pill during this time help in both the thing. So, OC pill is helping in taking care of this erratic release and of hormones in the body, a huge ups and huge down, and OC pill is also taking care of the accidental ovulation and accidental pregnancies in these people. So, you can give an individual at least 4 to 5 months of OC pill or maybe 6 months of OC pill, then you stop the OC pill, then you wait for 3 months, at least request the partner to use a barrier contraceptive for the next 3 months. If the patient is getting amenorrhea for the next 3 or 4 months, then you know patient is entering in the menopausal state. Menopausal state is much better than the perimenopausal state, because in that state you do not have this erratic ups and downs of the hormone. You do not have to take care of them, you just have to maintain the basal hormonal level. So, after 3 to 4 months of that, you do the LH, FSH and inhibin level. So, a very high LH and a very high FSH, both more than 20 or more than 40, and very low AMH and inhibin B will be giving you a clue that patient has entered in the menopause. You can get even the ultrasound done. A very minimal endometrial thickness is there after even 3 months of amenorrhea, ruling out the pregnancy, and you see that endometrial thickness is very low, 2 mm, 3 mm, you know that patient has entered in the menopause, and that is the time you can think of putting the patient on the routine HRT, the transdermal HRT. I will always talk about transdermal HRT because I feel very confident about it in terms